The color of the patient chart is informative. A manila folder is an urgent care patient, subject to regular visit limits. They may be seen for medical 3 times in 12 months and for vision once every 2 years. A blue folder is for patients who are part of our hypertension clinic. The medical visit limits have been lifted for these patients, but they should usually only be attending on a hypertension clinic night. The hypertension clinic is our only chronic care program at this time. An orange folder is for patients who have exhibited poor behavior during a previous clinic. The Director of Patient Services will have given them a letter, and a copy of the letter is in the chart stating what the difficult behavior is. These patients have been informed that if they continue to exhibit poor behavior, they may be banned. The red folder is for patients who have been banned from clinic with a heart, and they should not be admitted if they come to the clinic. Please notify the Director of Patient Services or another staff member if this should occur. Our charts begin with 5 basic paper forms. The first is the form completed online for each patient, either by the patient themselves or a volunteer who calls them. You will sometimes hear these referred to as JOT forms. The information in this form includes demographics and health history. The next is the exam form, where vitals and the provider assessment are documented. And finally, the discharge worksheet, which is filled out and reviewed with a patient by a discharge nurse and is the last stop of a patient's visit. These are the most common forms used during a patient visit. The forms are printed by the clinic assistant. Forms are reviewed by a staff member, and the patient file is prepared for the evening. During a clinic, many other papers can be added to the patient's chart, including referral forms, progress notes, and other special exam forms like school physical forms. These forms are added in the area they are needed. As patients are discharged, their patient chart is taken to the scanning room. That volunteer gets the papers organized in a consistent fashion and then scans the documents into a PDF format. The files are named with the patient's last name, first name, and clinic date, and then are saved and kept in a special shared folder. After scanning the records, the papers are stapled together. Each set of stapled papers in the patient's folder represents a visit to the clinic. You may see blue charts that look different than the others. These are our charts for our hypertension patients and are managed differently by that team. The day after clinic, the referral coordinator and volunteers review each patient file. This step is to make sure proper referrals have been made and to share information with referral sources. Information is shared with referral sources using HIPAA-compliant website called ShareFile. Each referral source has a folder that an assigned person from their organization can see. Referral sources can only see their own folder. Examples of folders we have include Bluestem Health Medical and Dental Clinic, Community Medical Referrals, the County Health Department Dental Clinic, Lincoln Family Medicine Center, Allergy and Asthma Clinic, and the University of Nebraska College of Dentistry. We add other folders as needed. Another thing that happens the day after clinic is a volunteer reviews the patient visit log on the patient's chart. Each chart has this log sheet on the inside page. The visit log tells how many times the patient has been to the clinic and for what service. This log is how we can tell if a patient is reaching their maximum number of medical visits in a 12-month period. The volunteer is making sure the information is recorded for each visit and adds the vital signs and labs in. The referral coordinator can also add in any notes if a referral has been made. The volunteer also writes the clinic date on the outside of the chart. This date is used to help us when we clean out the file drawers. If a paper chart has not been used for 12 months or more, we shred the contents and recycle the folder. Throughout the month, we get requests for medical records. These requests come from many different sources, including disability determination, medical homes, lawyers, and many other sources. Our referral coordinator coordinates the faxing of records. As we continue to grow and our patients become more complicated, the faxing activity continues to increase. We are able to quickly fax using the scanned files. The information from the electronic forms is downloaded weekly into a spreadsheet, and volunteers add additional information from each visit, like vitals and A1C results. This information is used to track how many visits we provide and how many people we serve. The data is also used for quality improvement purposes. That gives you some idea of what happens to a chart at Clinic with a Heart. The chart travels down a long and winding road and helps us to serve our patients.